It's really great to be a helper, and I think it's just in my nature. Basically, a typical day would be me just coming in, making sure I look at our surveillance system. The surveillance is just kind of monitoring and looking, observing, making sure that we're catching all the positive tests or anyone who may be under investigation for that disease. See what diseases are positive, and once it's positive, I look into the chart and I just make sure like the positive disease is reported to the health department and they can start their contact tracing and investigation. A lot of times, I'll also be rounding in the emergency department. Part of my role is an infection preventionist for the ED, so I'll make sure that everything looks good down there, providing education, especially about isolation practices with patients and just keeping staff safe and the visitors as well. We'll go to different health departments in Western North Carolina and we meet with them, give them updates about what's going on at our hospital, trends we're seeing with the diseases, as well as getting updates from them, any questions they have and what they're seeing at their health departments. A big part of it is education. Educating on vaccines is very important for helping the community contain the spread. So I initially thought I wanted to be a doctor. So I had to take a lot of chemistry classes, biology, ecology, organic chemistry, so that I can get into the clinical laboratory science programs. I went into the laboratory because it was kind of like a behind the scenes type of work, but you're still making an impact because they make like 80% of the diagnosis that doctors need to help patients. Instead of focusing on just one patient, I can focus on a whole population. And that's what brought me into public health. Once I started my master's program, I wanted to get into it because I just knew there was more for me. Like I graduated with my master's in 2020. That was like the perfect time, unfortunately, but fortunately to hop into public health and just working with military families and trying to get them on board with COVID-19 practices. It really helped me understand how disease spreads and being in close quarters. COVID was not easy, but it really helped build my confidence with educating people on CDC guidelines and things like that so that they can remain safe. I love being with people. I'm a people person, so it's been really great like being in this role. Some days I'm more in the background, some days I'm front and center. With epidemiology, with public health, it's really fun because you can literally like put graphs together and see like the trends and see what is happening in a particular area and then help to make interventions to solve it. Like your work has a really big impact.